You're watching The Source on CNN Philippines. I'm Pinky Webb. The DOH records more than 4,000 new COVID-19 infections. That's from April 24 to 30. That's over 40% higher than the cases recorded the week prior. Health officials say it's possible that the country will record around 600 new cases per day until June. With the rising infections, will the government bring back the mandatory use of face masks? Let's go straight to the source of the story. Health Officer in charge, Maria Rosario Vergeire. Usec, good to see you again. Maraming salamat po sa inyong oras. Let me already ask you, COVID cases up 42% from April 24 to 30. The positivity rate also high at about 15.9%, I think, based on the Octa Research Group. That's 3 times higher than the threshold of the WHO. First, Usec, what is driving the surge, if you even would call this a surge?
Well, it would be a lot of factors actually, hindi lang po isa. So there would be this circulating virus pa rin and continuously mutating. Meron tayong bagong sub-variant, yung R2 virus. Pangalawa po, yun pong mobility ng tao would always be a factor, no? So we have this continuous interaction because of the opening up of sectors. And then the third would be the vulnerability of each individual who's getting sick. They might not be vaccinated, maari po na vulnerable sila at matanda sila o di kaya may comorbidity sila. So lahat po ito are various factors that can affect, no, and can be the factors of this increase in cases.
I understand the factors that you're saying, Usec. However, it's hard to, I mean, there are a number of factors that you mentioned, but when you say mobility has been there since many months ago. Would it be the new subvariant? And what's the latest on Arcturus?
Actually, yung new subvariant was already classified by WHO as a variant of interest because it's causing increases of cases in the different countries across the globe. Pero ngayon po, dito sa ating bansa, isa pa lang po yung detection natin itong Arcturus. Although we are continuously monitoring, we're waiting for the latest genome sequencing result para makita natin kung nakarating na siya sa ibang region ng ating bansa.
Isa lang, actually I wanted to get an update on the numbers, Usec, kasi yung huling basa ko po, I wasn't sure if that's updated, but I tried to look, isa pa lang yung sa Arcturus na gumaling na. I guess we're just waiting for the new genome sequencing. What is there any other? I know that as you mentioned, Arcturus has been driving the surge in cases in about 32 countries. Last I saw. Is there any other variant of interest that the WHO or other countries are looking into?
Well, this is the newest that the WHO has announced. But for the others, it would still be the other variants or the sub-variants of Omicron which are circulating. Hindi lang po isa na andyan po yung pati yung mga iba pa hong sub-variants that we are still detecting up until now.
Okay, let's go to just the numbers. Would you say that daily cases of over 600 the past week, would you say this is an underestimation? Because I personally, Usec, know that a lot of people just do antigen tests and yung antigen di naman po nasasama sa official number.
Yes, ma'am. That is correct. Hindi ho natin sinasabi na kompleto itong mga numero na ito because most people are really using antigen test. Ngayon po, we're just averaging around 7,000 plus per day na test compared to before nung mataas talaga yung kaso sa atin. Hanggang 91,000 a day nakakapag-test tayo. Ngayon po, ang ginagamit ng mga tao, antigen, meron na rin naman kaming datos, although hindi naman po ganun kakompleto, but we have the trends of the use of antigen where we are getting around 300 tests per day na nagpa-positive sa antigen out of around 4,000 tests. So pagka inanon po natin yan, yung plus 300 natin, maaari po na around 40 to 50% po ang hindi natin nakikita.
Oh, so if there's yeah, that's right. No? So if isasama po natin yung antigen on the test that is being collected or submitted to the DOH for calculation, would you say nasa 1,000 na po tayo more or less a day?
Yeah, I can say that. Oo, medyo 1,000 na. Pero ang lagi nga namin sinasabi, let us not just focus ourselves on the numbers. tignan natin yung ano yung nangyayari sa health system natin. Nakikita po natin yung mga ospital, we are being able to manage this kind of situation. Hindi po dumadami yung mga civilian critical, yung mga namamatay, hindi rin po. Admissions are at that low level, hindi po ganun kadami. Kaya ang sinasabi natin ngayon, hindi natin kailangan matakot kasi most of these infections are mild and asymptomatic pa rin.
Yeah, I actually was going to go there. In the many interviews we've had, we're not just talking about numbers. We're talking about positivity rate. We're also importantly, we need to talk about hospital utilization, which you just mentioned. How's the hospital utilization so far? Is there any area, Usec, that is a cause for concern already in terms of hospital utilization?
Well, if you look at the different regions of the country and pag tinignan po natin, ICU na lang ang tignan natin, lahat po less than 20% utilization sa ICU. Although there are areas in the country or specific areas actually na binabantayan natin talaga yung kanilang ICU utilization kasi tumataas. Pero pag tinignan natin kasi kakaunti yung kama sa ICU. And this has been the problem since we've started. And hanggang ngayon, hindi pa ho nadadagdagan yung ICU beds nila. So ito po yung mga areas natin na maliliit dito sa NCR. Pati na rin po yung areas natin in Davao, also areas in Bar.
Got it. Okay, because konti po yung kanilang capacity, kaya madali po silang mapupuno. So mahirap pong, I guess, to really look into the numbers of that, no, Usec? Kasi yung iba, merong, let's say, 20 ICU beds. Yung iba naman, baka 5 lang. Okay, understandable. So mask mandate, that's something, is it time to bring it back? Although, of course, the IATF already made a recommendation on this. We'll talk about that after the break. We'll be right back. Our source today, Usec Maria Rosario Vergeire. So, Usec, yung pong sa masking, I know that the IATF already recommended not to impose the mask mandate. Usec, why? You were such an advocate of this. Palagi yung sinasabi nga, this is a first line of defense. Easy, mura. Well, of course, it's inconvenient for others. But why didn't you recommend this?
Well, I am still an advocate of masking. DOH is still an advocate of masking. But we need to understand that we cannot go back and forth with our policies for COVID-19. Hindi po pwede na every time that there would be increases in cases, we go back to our restrictions. We need to move forward on this and eventually have our people have that kind of behavior wherein they know their risk, they know how to protect themselves. That this is how we are shifting the mindset of our nation towards opening up our going to our new normal. So hindi ho nawawala yung advocacy namin sa pagmamask. Ine-encourage pa rin natin that people choose to wear their mask. Pero mahirap po yung pabalik-balik tayo ng restriction every time that tumataas ang kaso. We need to have a higher tolerance on this increase in cases. Kasi alam naman natin that it's still going to happen because the virus is still here.
But what happens? Would the IATF, because it seemed that at some point, sabi po ni Pangulo, it's up to the IATF, baka oo, sana hindi, pero baka oo. Meron ho ba kayong tinitingnan na metrics, for example, definitely hospital utilization, if it starts to go up, and numbers as well, positivity rate is already up, that you may require us to wear masks again?
The metrics, actually the direction, yun mismo. Kung saan gusto na natin, as I've said, the direction would be that nationally, ayaw na po natin na imandato na babalik tayo sa mga restriction na to. But we are giving authority and we are empowering our local governments as well as the establishments within the local governments na kung sa tingin nila, assess nila yung kanilang sitwasyon, sa tingin nila na kailangan pag-mask ang mga tao, they can do that. But nationally, hindi po. Kasi nga, as I've said, having back and forth policies would not really help us overcome or move away from this kind of situation. Although DOH is closely monitoring, and once we see that it is critical already, and then we recommend to the President and the IATF.
Okay. I think it's also Bacolod and Iloilo City that their LGUs imposed masking again. Usec, May 8, Japan is declassifying their COVID-19 to the seasonal flu. Is this the direction we're taking as well?
Dadating tayo dyan, ano? But maybe not at this time. Actually, the ambassador and the health minister yesterday was here with me and they were telling that to me. And ang sabi nga natin, we will eventually get to that point. But for now, let us closely monitor. But yes, this is the direction actually. Kasi sabi nga natin, the virus is here to stay with us. As long as we know how to protect ourselves, we are aware kung paano nakukuha yan at paano magagamot at paano proteksyonan ng ating sarili, and then we can be able to classify that eventually as a common illness here in the country.
But what do you think that's possible within the next few months to reclassify ho ba o treat COVID-19 as a seasonal flu?
Well, actually, it's all part of having this kind of shift from a pandemic into endemicity. So ito pong pagkakaroon ng endemic na state ng isang bansa sa isang sakit, kasama po yan that you are now classifying this illness as something common already in the country. So hopefully, towards the end of the year, sana po maging stable tayo and ang mga tao matuto na rin talaga tayo. No? We imbibe on that culture and practice na ang proteksyon ay nasa sa atin based on our individual risk and we know how to manage ourselves when we get sick.
Last question, update on the bivalent vaccines?
Yes, ma'am. We are continuously pursuing this arrangement with a country who's going to donate to us around 390,000 doses of bivalent vaccines. And hopefully, if all would be okay, towards the end of May, we will be receiving that. We've already issued our guidelines kung saan unahin po natin ang healthcare workers and our senior citizens. And then kapag dumating na po yung ibang mga donasyon na ine-expect natin, then we can be able to expand the coverage.
So all these are just donations, to be clear. Lahat po sila donasyon, yung ating hinihintay?
Yes, ma'am. Sa ngayon, donasyon po tayo because we still do not have any law as basis for us to get to go through this kind of agreements. Pero once the CDC bill would be enacted into law, magkakaroon na tayo ng basis and hopefully we can already procure the bivalent vaccine.
Health Officer in Charge, Maria Rosario Vergeire, thank you so much for your time, ma'am, and take care of yourself.
Maraming salamat po.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.